supervisor, so I supervise a program called the Positive Parenting Program. And you may wonder, well, why do you work for public health and you talk about parenting? Who can imagine that? What do y'all think? What does public health have to do with parenting? Everything. What do parents mean to children? And what is our world going to look like 10, 20, and 30 years from now if we pour into our parents and help them to pour into our children to make positive households, to make healthy families? We have goals in our community to reduce the incidence of children being hurt non-accidentally, to reduce the number of children that make visits to the emergency room, to reduce the number of children that are removed from their home by DSS, and to generally make healthy families. How many parents do I have in the room, just by a show of hands? How many parents, even if your children are grown, even if your kids, parenting is easy. I know it was easy. Brother Boyd agreed with me. See how you laughing? Parenting is easy. It's the easiest thing in the world. Let me read this for you guys. For those of you, Sister Little just talked about a job opportunity, so I have a posting I wanted to bring to you all's attention. They just need one couple to raise a child, no experience necessary. Applicants must be available 24 hours per day, 7 days a week, and must provide food, shelter, clothing, and supervision. No training provided. No salary. Applicants pay at least $180,000 over the next 18 years, and this is old, so it's probably like $250,000, $250,000 plus dollars that we pay over the next 18 years. And some people, child care just costs that for a child. Thank you, all your life. Accidental applications are accepted. Single people may apply, but should be prepared to do twice the work. Who's applying? We all did. we all applied. All the parents that raised their hand, we all applied, and whether we wanted to apply or not, the Lord called and said, I got a job for you. I got a job for you, and I need you to take this job 24/7 and work it. And no, I'm not going to tell you what the child's temperament's going to be. I'm not going to give you any instructions. I'm not going to tell you anything. Just here is a baby. And I look at my kids and I see them acting like me, and I say, well, Lord, why did you do me like this? Lord, how did you give me meat 3 times? I married this nice, quiet girl. Why can't they be quiet? So, being a parenting is rewarding. It can be enjoyable, but it's also demanding, it's frustrating, and it's exhausting. Talking about parenthood, and it's really a job that we learn through trial and error. We try it, and how many of y'all the oldest child in your home, the oldest kids? I'm sorry, Sister Cook, I'm sorry. The oldest kid in the household is trial and error. We try it, and if it didn't work, we do it different next time. So the babies like me got it perfect. I'm the baby. We get all the good parenting. Ain't that right, Auntie Debbie? So every parent has to develop their own goals in your approach to parenting. And so Triple P as a program, it is an evidence-based program. Anybody besides Sister Mona know what that means? Oh, I see the educators. Anybody know what evidence-based means? What it means is, for 30 years, Triple P as a program has been researched. And over those 30, it's more like 40 years now. But over those years, there have been peer-reviewed articles by professionals, doctors, people who are qualified and experts in this area that has shown over time that the program works if you work the program like it's supposed to work. So Most evidence-based programs are, you got to go A, B, C, D, and if you do it this way, it works. The program started in Australia that long ago, but it's been tried and true in over 27 countries, the USA being one of them, and in 17 countries, 27 languages. And so it didn't matter, the evidence showed, it didn't matter whether you lived in the UK, whether you lived on the continent of Africa, Australia, or the US, parents all over the globe are dealing with the same issues in their household. And so this program was created to support parents. So when we work with parents, and unfortunately the program we work doesn't work directly with parents, but our goal at Public Health is to work with professionals to train them to be able to provide the service to the community. So we're trained to provide the service, but we don't work directly with parents unless, in a situation like this, or if I have personal people that I work with. So nobody's a perfect parent, and so the state of North Carolina looked at the Department of Health at the state level looked, and Public Health looked and said, well, we need a program that parents can use all over the state, because every parent, regardless of your socioeconomic status, meaning regardless of how much money you make, regardless of what conditions you live in, whether you live in South Charlotte, whether you live in North Charlotte, West, South, East, West, Uptown, it don't matter where you live, if you have a child, at some point or another, you need support. And so that's why